Hi everybody, it's Dr. Freddie here with our latest edition of Dr. Freddie Said So. And if it looked like I just had a headache there, well, I actually didn't. But I know this is how a lot of you feel when you're getting a headache or neck pain. It feels like there's a vice squeezing on your head and like your head's going to explode. And you know, neck pain and headaches is definitely one of the #1 issues that people ask me about. And so today's question came from Madeline, who wanted to know why she's getting so many headaches. And even as a young person, you know, how that was constantly plaguing her from being able to study and go to school and concentrate, and was affecting how she even saw herself, you know, in the future with her job. Well, as much as headaches seem to appear from the head, but 90% of headaches have been shown to actually come from the neck. And as we can see here, the nerves in the neck run through the spine, from the brain through the spinal cord, and these yellow lines here represent the nerves. And you can see many of them go up into the skull, into the head, but they actually come out from this very important area near the base of the brain called the brain stem. And so a lot of these nerves will come from those areas in the first and second bones in the neck and travel up into the head, into your temples, behind your eyes. So oftentimes it might feel like you're having pain behind the eyes or in your head. You might call it a migraine, or you might have, you know, seeing spots or auras, or have ringing in the ears. A lot of those issues come from areas in the base of the neck. And so what we need to do, first of all, is find out what the alignment of the neck looks like. Because traditionally, people that have a headache will often want to get rid of those headaches through medications, whether it be Tylenol or Advil or more serious prescription drugs, which have serious side effects. And #1, they don't even get to the cause of the problem. And so we see some patients come in even addicted to these painkillers, and they're getting headaches because of withdrawals, because they haven't been taking as many painkillers, and every week they have to increase the number of painkillers they take. So we all know that drugs aren't good for us, but you might not know what the alternatives are. And so what we need to find out is if the headaches are being caused by problems in the alignment of the neck, while the normal curve of the neck is shaped more like a C shape. Research shows it should average around 42 degrees from the 2nd to 7th bone in your neck. And so the only way to measure that is through special x-rays. And so we have a special digital x-ray here in the clinic that allows us to measure that to the 10th of a degree to actually see how the alignment of that curve is in the neck. That curve is so important that scientists call that the arc of life. And so if we have less than that 42-degree curve, or our head is forward in what's called forward head posture, well, then the greater chance that we're going to have headaches, studies have shown, as well as neck pain. You have your skull, which is about 12 pounds, sitting on this very tiny object, your neck. So imagine a bowling ball sitting on your shoulders. That's pretty much what you have. So just think, the more your head is forward, what is that doing to these muscles on the neck? Are they working less or more hard? They're definitely working harder. So how does that feel, you think, at the end of the day when you've been sitting at your desk or computer? Or worse, today, what are we doing? We're seeing text neck for people sitting on their phones. And so we're creating more and more stress on the bones and the nerves in the neck, which are going to create pressure on these nerves and cause what laymen call pinching of the nerves, or what we call as chiropractors subluxation. And these subluxations now irritate the nerves, which now radiate pain up into your head, or can produce local pain right in the area in the neck. It might even shoot down your arms. Those nerves even connect to the organs and can connect to areas such as your heart. And so this is why we take it very seriously, because you may be thinking it's a headache or some sort of pain that just came on, when it could be an indication of something more serious that's causing these issues. So we don't want to ignore or just band-aid the pain. And that's why an x-ray is very important, because it helps us find the hidden cause of some of these issues that you may have just been feeling, but on x-ray may have shown deterioration or arthritis within the bones that may have developed over 10, 20, 30, 40 years. It's like a heart attack. By the time you feel a heart attack, you know, it's already 10, 20, 30, 40 years that your arteries may have developed inflammation that have been causing those problems, but you might not feel it till it's already too late. So that's a great question, Maddie, you know, in terms of finding out the cause. And the solution, obviously, once you know the cause, is to correct that alignment, get that curvature back in the spine. which has been found best through specific corrective types of chiropractic adjustments using techniques similar to what we use in our clinic. Also working with posture and improving posture through special tractioning devices and exercises that are specific to what is on your x-ray. So the answer is get checked. That's the only really way to know if you have this problem, if that's causing your headaches or neck pain. Get a checkup, find out by a specialist similar to myself as to what's actually going on, what's causing it, and also find out the natural ways to try to correct it. So thanks again for that question, Maddie. If you guys have more questions, please channel it to us through our website at www.chiropracticfirst.ca. You can contact us through the website, ask us any questions at all. If you want to reserve a checkup, you're welcome to do it through that site as well, or answer any other questions you have. Follow us on social media through Facebook or YouTube. It's Chiropractic First Natural Health Group. We definitely look forward to talking to you more in our next edition of Dr. Freddie Said So. Have a great day.